Hello, everyone. Welcome back. Thank you for joining us. I'm Steve,
I'm Scott.
and together we're Backyard Musings with a science and technology channel. We're broadcasting in Apple Valley, California. Before we get into our segment, just wanted to remind you the parade of planets tonight, and it starts really fast. You'll have about 20 minutes to see Saturn, which will set very soon after sunset. So that's not nautical twilight, that's sunset. So it's even going to be difficult. So and
Yeah,
then
so sunset around here is what, about 5:40,
yeah, but there's
5:50?
still light in the horizon. There's still nautical lights, so
Yeah.
it'll be a little bit difficult. And then Neptune, you will definitely need a telescope to see Neptune, the next one up. And then the little tiny planet Mercury, you might be able to get that with binoculars. And then Venus, that's easy to see. After that, Uranus, you probably need binoculars. You could do it with binoculars, Uranus. And then Jupiter, that'll be easy, right? If you have binoculars, you might see the moons, 4 moons of Jupiter.
That would be cool.
And then I think it's Mars is the last one.
And have they stated which direction we're going to be looking at?
Oh, west. You got to look west.
Southwest.
Look west, and
Okay.
then you just
Keep
keep moving to the east.
Gotcha.
And you'll see those planets in the order that we announced.
Cool.
Our astronomy people have been working hard to give us that information.
It's about time.
Okay. A study suggests that patients with wet age-related macular degeneration, AMD, may regain vision through a novel approach, removing abnormal blood vessels and transporting stem cell-derived retinal cells. So it's with the eyes, right?
Right.
Patients with complete vessel removal saw better outcomes, hinting at a potential game changer for vision restoration. Would you like to know more?
Absolutely. Age-related macular degeneration, AMD, is a leading cause of vision loss and blindness in older adults. In its more severe form, known as wet AMD, abnormal blood vessels grow in the macula, the central part of the retina responsible for sharp, detailed vision. These fragile blood vessels can leak fluid and blood, damaging the macula and impairing vision. Although wet AMD makes up a smaller portion of overall AMD cases, it is responsible for 90% of the AMD-related blindness. So,
yeah, this is no joke.
Number.
Yeah. Just a shout out to my son. He's DJ Maculate, my middle son, DJ Maculate. And I must be Daddy Maculate. Okay. So I used to take these little dropper pills that would because I couldn't see up close, right? I got to get readers.
You were
to see up close.
What do they call that? You were farsighted.
Yes, farsighted.
Right.
Definitely. And so I took these little drops that did something to the eyes, to the pupils or whatever, to the macula, retina, that may be able to focus more. I could read up close without readers. And it lasted about 4 to 6 hours, and it gave me headaches, but that's what the medicine did. It's very expensive, like $75 for just a little, dropper thing.
Okay, they call that, there's a procedure for that, when they can look into your eye. What do they call that? I have that done every once in a while.
Yeah, they got to put something in so that your pupils dilate fully.
Yeah, dilation. Yeah. That's right.
And then they get in there and then they look.
Right.
But this made you focus and more concentrate so you can see up close. But it was expensive. Okay.
So you don't do that anymore?
No, because it was it's just easier to put the readers on, and just pump, because it only lasted for like 4 to 6 hours, and you could only do it like once or twice a day.
Oh, okay.
Yeah. So early stage wet AMD can be managed with medications that slow abnormal blood vessel growth. However, these treatments become less effective once the disease progresses. A new study led by Yang Liu and colleagues at 3rd Military Medical University Southwest Hospital in China, that's a mouthful right there, Military Medical University, and published February 27, 2025 in Stem Cell Reports, suggests a potential alternative for advanced cases. The approach involves surgically removing the abnormal blood vessels and transplanting stem cell-derived retinal cells to replace damaged tissue, offering hope for improved treatment outcomes. Sounds promising.
We like that.
Yeah.
In their clinical study involving 10 patients with wet AMD,
that's it?
Not much of a study.
No.
The researchers first developed a method for safely removing the newly formed blood vessels, followed by the transplantation of stem cell-derived retinal cells to replace the patient's damaged or lost retinal cells. The retinal structure improved in those patients where blood vessel patches were completely removed during the surgery, suggesting that the transplanted cells survived and repaired the damaged retina.
Cool.
Yeah, good outcome. Further visual acuity remained stable or improved in those patients during the 12-month follow-up with limited side effects.
Like that, limited side effects,
yeah,
blurriness or whatever. In contrast, patients where the blood vessel patches could only partially be removed experienced persistent bleeding and inflammation in the eye and an incomplete regeneration of the retina, and vision did not improve in those patients. That would stink. Yeah. The researchers concluded that complete and safe removal of the blood vessel patches prevents inflammation and generates a milieu favorable for transplant survivor and integration. Milieu is like a fight. Follow-up studies with larger groups of patients are required to confirm the clinical efficacy, of course, and favorable safety profile of this type of treatment.
Wet macular degeneration is one of two types of age-related macular degeneration. The other type, dry macular degeneration, is more common and less severe. The wet type always begins as the dry type. Early detection and treatment of wet macular degeneration may help reduce vision loss. In some instances, early treatment may recover vision. Macular degeneration doesn't affect side vision, so it doesn't cause total blindness.
So you can see out the side of your eyes.
Yeah.
Peripheral.
Yeah, peripheral eye.
Wet macular degeneration symptoms usually appear suddenly and worsen quickly. They may include visual distortions, such as straight lines that seem to be bent, reduced central vision in one or both eyes. That's you, right?
Yep.
You're just doing that right now.
Yep.
The need for brighter light when reading or doing close-up work. That's kind of like me. Difficulty adjusting to low light levels, such as when entering a dimly lit restaurant or theater. That's definitely me. Increased blurriness of printed words. Not so much me. Difficulty recognizing faces. A well-defined blurry spot or blind spot in the field of vision.
See your eye care professional if you notice changes in your central vision, lose the ability to see fine detail. These changes may be the first sign of macular degeneration, particularly if you're older than age 60. Okay, so what was it, about 20 years ago, maybe not quite that long, maybe a little longer. LASIK surgery became a really big deal,
yeah,
right?
I had LASIK.
Did you? Okay.
Yeah.
So my eye, I mean, I've worn glasses since I was 10, so about almost 60 years, and so over time, I had nearsightedness. I couldn't see far away, and my eye doctor told me, don't keep your glasses on all the time. Just wear them when you're doing distance stuff. Well, 10-year-old kid, I kept them on all the time, so my eyes
10-year-old kid
became comfortable with wearing them, and so now I got to wear them all the time. And now I've transformed into, I think we talked about this one other time about this kind of eye stuff, is I wear progressive lenses.
Yeah, I got progressives too.
Yeah,
not these. These are full readers. I got progressives in there.
Right. So now I wear them all the time, and I have to wear them definitely when I'm reading now. Where I didn't have to when I was a kid, but my eye doctor told me, because I asked him, I said, "Hey, so am I a good candidate for LASIK?" And he goes, "You are. Anybody is, but he said within a few years, maybe 5 years at the utmost, at the outside, you'll have to go back to wearing glasses again, or have another LASIK surgery." And so I just opted not to do that. I mean, I just do the glass thing, but I don't know. You don't hear about LASIK that much anymore, I guess. I don't know. Maybe.
Can I tell you the scam that I underwent?
Oh, yeah.
Yeah.
Absolutely.
So they fixed my eyes perfect 20/20. I mean, after I got up off the surgery table, I could see the clock.
Did you do one eye at a time?
Yeah. Yeah.
So, okay.
One eye at a time.
Gotcha.
Right. Boom, boom. Right next to each other.
Oh, okay.
Yeah. And so, yeah, as soon as I remember
the same procedure. They did one eye and then
they have these metal things that opened up, and then they squirted a gel in there to
kind of numb it,
yeah.
Right.
And then they just went to the other eye, So but I remember taking my glasses off, so that I could remember the blurriness. And I forgot that since then. But yeah, when I got up, I could see perfectly. So I had 20/20 right away. And then after about 10 years, it dropped to 20/30, 20/25, right? And I was
Which
at that.
still is not bad.
Yeah, and
I
then,
know a lot of people walking around with that kind of eyesight that don't wear corrective lenses. So
yeah, and I'm at the 20-year mark now, and I've had to get readers, right? And I talked to the doctor who did the surgery, and this is where the scam comes in. They're like, hey, this was a lifetime touch-up, lifetime guarantee. I want them touched up. Well, we gotta. You should wait until you have Cadillacs so they can take the Cadillacs out.
Cadillacs,
whatever.
Cataracts.
Yeah, Cadillacs.
Okay.
So they can let's do that, and then we can touch up. And it's like his medical opinion. You know, they sold me on the get your touch up lifetime guarantee.
Was the procedure more for that little extra? Offering that
well,
extra?
I don't know how much money, but that it's a bait and switch. It hooked me in.
Yeah.
You know, and then based on his medical opinion, wait until you get Cadillacs.
Wow.
And and so now I got readers. I can see far away. I can read far away. It's the up close that, man, it hurts. I got to put these glasses on or the reader. And then with the progressives, I'm like, my head's back like this when I'm looking at the computer, my head kind of gets, my neck.
I try that. I can't get into that remaneuvering of the eyes and stuff. So that probably affects it a little bit, but
do you do that when you're looking at the computer screen? You put your head back?
I don't. Yeah,
and
I have done it a few times because I used to do that with my regular glasses. I would tilt them and make the, what do they call it, the diffraction or whatever, the lens a little bit clearer sometimes.
Yeah.
And my eye doctor told me, he goes, don't do that. We'll just, you just need to get new glasses. And I'm going, yeah, really?
Yeah, need to pay you some money.
Exactly. Yeah, more money out of my pocket.
So I found myself with the glasses off. I'd be doing this out of habit, kicking my head back out. And I was like, what am I doing?
Yeah, I will do that at night if I'm driving and there's a lot of oncoming traffic. I'll tilt my glasses a little, or tilt my head a little bit to adjust it. But yeah, I just kind of deal with it. But I'm interesting. I didn't know you had LASIK, so yeah,
I'm surgically enhanced.
I'm glad that I opted not to do that. So, but anyway,
all right, folks.
Let us know if you have any issues like this. So.
Thanks for joining us.
Take care, everyone. Thanks.